Do you know what dengue fever is and how it spreads? Dengue fever is more than just a buzzword we hear during the rainy season. It's a significant health concern that affects millions of people worldwide every year. In the next few minutes, we're going to embark on a journey to understand this disease better. We'll start by demystifying what dengue fever really is and why it's such a big deal. Then, we'll examine the telltale signs and symptoms that could suggest a dengue infection. But that's not all. We will also explore the mechanics of how this disease is transmitted, often in ways you wouldn't expect. Armed with this knowledge, we will then discuss practical and effective strategies to prevent dengue fever because, as you'll soon find out, prevention is indeed better than cure when it comes to dengue. So, are you ready to learn? Stay tuned as we delve into the details of dengue fever. First, we need to understand what dengue fever is. Dengue fever is a mosquito-borne disease caused by the dengue virus. This virus belongs to the Flaviviridae family, and it has 4 different types, each one of them capable of causing the disease. The dengue virus is primarily transmitted through the bite of an infected female mosquito, specifically of the species Aedes aegypti. These mosquitoes are most active from dawn until dusk, but they can also bite at night. Dengue is a global problem and is endemic in more than 100 countries. It is especially prevalent in tropical and subtropical regions around the world. This includes parts of Southeast Asia, the Pacific Islands, the Caribbean, and Central and South America. Unfortunately, due to factors such as urbanization, population growth, increased travel, and lack of effective mosquito control, the incidence of dengue has grown dramatically in recent decades. The disease varies in severity. In its milder form, it presents flu-like symptoms and can be mistaken for other illnesses such as influenza or typhoid. However, severe dengue, also known as dengue hemorrhagic fever, can be life-threatening. It's a more serious form of the disease that can cause bleeding, blood plasma leakage, and low platelet count. One of the tricky aspects of dengue fever is that once you've been infected with one type of the virus, it doesn't provide immunity against the other 3 types. In fact, if you get dengue a second time, it's often more severe than the first. There is no specific treatment for dengue fever. Instead, the focus is on relieving symptoms and supportive care, which can include hydration and pain relievers. And while there is a vaccine for dengue, it's not suitable for everyone and its efficacy varies. So, dengue fever is a significant public health concern, particularly in tropical and subtropical regions. It's a complex disease with varying degrees of severity, and it's caused by a virus that is transmitted through the bite of an infected mosquito. Now that we understand what dengue is, what are the symptoms to look out for? Dengue fever doesn't go unnoticed, it comes with a set of symptoms. As with many illnesses, dengue fever doesn't play hide and seek. It announces its presence with a distinct set of symptoms, ranging from common flu-like symptoms to more severe signs that may indicate a serious turn. Let's start with the common symptoms. They usually begin 4 to 7 days after the bite of an infected mosquito. The onset is often sudden, with high fever that can climb up to 104 degrees Fahrenheit. Accompanying the fever, you may experience severe headaches, especially behind the eyes. This is a distinguishing characteristic of dengue fever that sets it apart from other illnesses. Body aches are another common symptom. People often describe it as feeling like their bones are breaking, hence the old nickname break-bone fever. You may also experience joint and muscle pain, making movement difficult and uncomfortable. The discomfort doesn't stop there. Nausea, vomiting, and a rash that appears 2 to 5 days after the onset of fever are also part of this unwelcome package. While these symptoms are uncomfortable, they are usually manageable. However, in severe cases, dengue fever can progress to a more serious condition called severe dengue or dengue hemorrhagic fever. This is characterized by abdominal pain, persistent vomiting, rapid breathing, bleeding gums, fatigue, restlessness, and blood in vomit. The skin might also become cool and clammy. A particularly worrisome symptom is a sudden drop in blood pressure. This can lead to shock, organ failure, and even death. Severe dengue is a medical emergency and requires immediate medical attention. You may be wondering, why are we talking about such unpleasant symptoms? Well, knowledge is power. Recognizing these symptoms can not only help in early detection, but also prompt the necessary medical intervention. Remember, dengue fever is not something to be taken lightly. It's a serious illness that can have serious consequences if not treated promptly and properly. Recognizing these symptoms can help in early detection, but how does dengue spread? We'll delve into that in the next segment. Dengue fever isn't contagious like the common cold. No, it doesn't spread directly from person to person through touch, sneezing, or coughing. Its mode of transmission is a bit more complex and involves a tiny yet potent vector, the mosquito. Now let's understand this process of transmission. It all starts with a mosquito, specifically the female Aedes mosquito. You see, this mosquito isn't born carrying the dengue virus. She picks it up when she feeds on the blood of an infected person. While this mosquito enjoys her meal, she unknowingly ingests the dengue virus along with the blood. Once the virus is inside the mosquito, it needs some time to incubate. This period is usually about 1 week. After this, the mosquito is ready to pass on the virus, not because she wants to, but because it's just how nature has designed this process. When this infected mosquito bites a healthy person, she transfers the virus into their bloodstream. The virus then begins to multiply, and after a period of about 4 to 10 days, the person starts showing symptoms of dengue fever. This cycle continues when another mosquito bites this infected person, ingests the virus, and goes on to infect another unsuspecting individual. It's important to note that not all mosquitoes spread dengue. Only the Aedes species, specifically Aedes aegypti and Aedes albopictus, carry this virus. These mosquitoes are day biters, with peak hours of activity at dawn and dusk. They usually breed in stagnant water found in flower pots, old tires, buckets, and other similar containers. The dengue virus cannot be transmitted through casual contact, sharing utensils, or even through breastfeeding. It's the mosquito that plays the critical role in this transmission cycle. Simply put, no mosquito, no dengue. Prevention is always better than cure. So, how can we prevent dengue fever? The answer lies in disrupting this transmission cycle, but we'll delve into that in the next scene. Stay tuned. Dengue fever can be prevented with some simple measures. With the right know-how, you can significantly reduce the risk of falling prey to this menacing fever. Let's delve into what you can do to keep dengue at bay. Firstly, cleanliness is key. Mosquitoes, specifically the Aedes species which transmit dengue, breed in stagnant water. Therefore, it's crucial to ensure that your surroundings are free from potential breeding spots. This includes emptying and cleaning water storage containers on a regular basis, making sure that flower pots or vases don't hold stagnant water, and properly disposing of items like used tires or plastic containers that can collect rainwater. In addition, household cleanliness should be maintained. Regularly clean drains and gutters to prevent water from pooling. Also, keep your home and yard clean and free from clutter where mosquitoes can hide and breed. Next, let's talk about mosquito repellents. These come in various forms, such as creams, sprays, and electronic devices. It's advisable to use a repellent that contains DEET, a chemical proven to be effective against mosquitoes. Apply it on exposed skin, especially during the early morning and late afternoon when dengue mosquitoes are most active. For those who prefer a more natural approach, there are plenty of plant-based repellents available, like citronella, lemongrass, and eucalyptus oil. However, remember that these may not be as effective as DEET-based products. Also, consider using physical barriers like window screens, long-sleeved clothing, and mosquito nets, especially for young children and the elderly who are more susceptible to dengue. Lastly, community participation is vital. We should all take responsibility for keeping our neighborhoods clean and free from mosquito breeding sites. After all, mosquitoes know no boundaries. To sum up, preventing dengue is all about maintaining cleanliness, using effective mosquito repellents, and being an active participant in your community's anti-dengue efforts. Remember, your safety is in your hands. With a little vigilance and effort, we can all contribute to keeping dengue fever at bay. Dengue fever is a global health concern. As we've explored in the past few minutes, this mosquito-borne illness is far-reaching, touching many corners of the world. We've learned that dengue fever is not just a sickness, it's a complex disease with a wide range of symptoms, from mild to severe. Understanding dengue fever is the first step. Recognizing the symptoms, which can range from high fever and severe headache to joint and muscle pain, is the second. But perhaps most important is understanding how dengue is transmitted. It's through the bite of an infected Aedes mosquito, an insect that thrives in and near human lodgings. Prevention, however, is our strongest weapon. By taking steps like eliminating standing water and using insect repellent, we can significantly reduce the risk of contracting this disease. Let's not underestimate the power of awareness and early detection. Stay safe, stay informed, and remember, knowledge is the key to prevention.